Hello, this is the reJAWvenator, and I'm going to show you how to perform reJAWvenation. reJAWvenation is placement of filler to restore and enhance the jawline. This patient mainly needs enhancement. This is the area where I place the entry point for the cannula, and this is the antigonial notch where the vessels are. In this patient, we are choosing Restylane Defyne for the correction. She has relatively thin skin, so a more structured product like Restylane Lift would be visible. Restylane Defyne has a very high G prime. In this patient, we are placing the insertion port along the jawline anterior to the vessels, and we're using a 22 gauge cannula with Restylane Defyne. We're going to place the filler along the jawline up to the gonial angle. We are using the preplatismal plane because this plane is extremely safe because it is superficial to the vessels, and you get more efficiency using the filler in this plane. The gonial angle in a female is between 120 and 140 degrees. It should be gently curved. Too structured makes the patient look masculine. The direction of the cannula is then flipped and it is placed into the prejowl sulcus and marionette area. The cannula can be placed into the chin area if that is desired at this time as well. You can now see that the procedure is complete and you have a gently curved ascending ramus and very smooth and distinct jawline. This took less than a couple minutes. Now we're doing the opposite side in fast motion, and it's done in a similar fashion. Cannulas is the way to go for this procedure because there is minimal to no bruising. The results of reJAWvenation show a much firmer and distinct jawline and gonial angle. 1 cc total of Defyne was used.